Good afternoon. Here we have syndrome of Stevens-Johnson. Catholic University Faculty of Medicine. I'm a student. Here we can see my Outlook, Facebook, and Twitter links where you can find more information. And here is the clinic case. This is a case of a 13-year-old girl who was admitted to Francisco de Casa Bustamante Children's Hospital here in Ecuador, and who developed a severe form of mucocutaneous ulceration, oral and ocular surf manifestations. An initial biopsy compatible with erythema multiforme was obtained. Before the initial assessment, the patient was given strict care to avoid overinfections and possible repercussions. After 13 days at the hospital, she was discharged. Now we have the abstract. Stevens-Johnson syndrome and toxic epidermal necrosis manifested in most cases as a skin reaction to drugs, constitute a similar clinical spectrum with different degrees of epidermolysis. Both entities are distinguished by the severity and extent of skin lesions, also affecting mucous membranes, eyes, respiratory system, digestive system, and urogenital tract. Here we can see a video. Well, a girl is affected about this syndrome.
This young lady is Leanne Howes of Norwich. She took Zantac to treat her irritable bowel syndrome. She had an allergic reaction, which ultimately led to Stevens-Johnson syndrome. Potentially deadly syndrome is what actually killed NBA basketball player Manute Bol. Her entire body was gripped with this condition. Tennis ball-sized blisters ripped through her skin. It nearly killed her. Her eyelashes, eyebrows, and nails fell out, and her weight fell to just over 70 pounds. A spokesperson from Zantac stated, "We deeply sympathize with anybody who suffers from Stevens-Johnson syndrome." We're happy to report that she did make a recovery. Although her health isn't perfect, she's 100 times better than she was at the worst of her symptoms. Please click like to support awareness of Stevens-Johnson syndrome. Unfortunately, people reported the original video that we posted about this as too graphic. Apparently, video content is not what people want to see. Leave your comments below if you feel that YouTube is too restrictive about medical videos. I'd love to show you more first-hand account of this individual's struggle with Stevens-Johnson syndrome, but at this time, YouTube does not allow that sort of free speech. Thanks for watching, and goodbye.
So we're going to continue with this exposition. And now we are going to have the symptoms. It is characterized by temperature rise without half measurable, sore throat, and increased salivation. The next day, it presents lip edema, generalized blistering blisters on skin and mucous pseudomembranes, stinging or burning, itching skin. Now we're going to see a video about the symptoms.
Brenda Fulmer, I'm a partner with the Mass Tort Unit at Cersei Denny. Do you know how to protect yourself from dangerous drugs and hypersensitivity reactions? There are more than 100 drugs that have been linked to a potentially fatal hypersensitivity reaction. This reaction is part of a spectrum of conditions that includes Stevens-Johnson syndrome and toxic epidermal necrolysis, which is also known by the acronym TEN. This drug reaction has been linked to penicillin, sulfur-based drugs, and a number of other medications or combinations of medications. In its earliest stages, Stevens-Johnson syndrome usually begins as itching or a rash with flu-like symptoms. The reaction can quickly progress to include blisters on the skin, ulcers in the mouth and nose, and peeling of the skin. The reaction often occurs with only a day or two after starting a new medication. If the new drug is stopped quickly, the progression of Stevens-Johnson syndrome can often be stopped. If the condition is not promptly recognized and treated, however, the patient can suffer devastating injuries, including loss of skin all over their body, blindness, arrhythmias, and even death. The lawyers at Cersei Denny handle lawsuits against drug manufacturers who have failed to provide proper warnings regarding the risks of Stevens-Johnson and TENS. Since Stevens-Johnson syndrome can result from improper medications being prescribed to patients who are vulnerable to developing Stevens-Johnson and is often misdiagnosed by physicians, patients who have been injured or died may also have claims for medical malpractice. Stevens-Johnson syndrome has been linked to a number of different medications, including numerous antibiotics such as Bactrim and vancomycin, seizure medications such as Dilantin, over-the-counter pain relievers like Motrin, and arthritis medications such as Bextra.
As we can hear, this is Stevens-Johnson syndrome symptoms. Now we have the physical examination. The patient is conscious, algica, fever, 39 grades, obvious signs of moderate dehydration, conjunctival hyperemia, oral mucus bullous, presence of vesicles, edema and erythema lips, trunk, upper limbs, and lower purpatic maculas observed confluent. And here we have another video. Stevens-Johnson syndrome is a reaction to medication that few people are aware of. In this case, the syndrome was caused by a drug. A rash started to spread all over the body and I felt very unwell. The rash blisters. The skin started to peel off in some areas, whilst others started to blister, and the body started to swell up. She started to suffer dry eyes and mouth. And she was admitted to hospital and diagnosed with a syndrome of Johnson. On February, her skin was peeling off in sheets. Her eyes were bad and they too were burned. Her vision was affected. ophthalmology. One level is observed eyelids, blepharitis with mucopurulent secretion and conjunctival hyperemia past 24 hours, clear cornea and anterior segment with no cells, no flare, no signs of uveitis. Here we can see a treatment.
We're the last resort for patients with severe corneal disease, a disease like Stevens-Johnson syndrome. If they survive the acute, the rest of their lives are governed by the pain they have in their eyes. It's excruciating.
In terms of one disease where our intervention changes their lives, it's Stevens-Johnson syndrome. And it turns these patients from recluses, because they simply cannot stand to have their eyes open out in the world because it hurts too much, to at least having the ability to function with their eyes open. There's two miracles in this world. One is the survivors of SJS, because they endure something that you couldn't even dream of. The second miracle is the Boston Foundation for Sight, because it gives the life back that they thought they lost.
Now we're going to see another video.
Ethan developed a more severe form of Stevens-Johnson syndrome called toxic epidermal necrolysis, TEN, so we call it TEN. And he had a severe form of the eye disease as well.
He was having a lot of pain, and his eyes were completely red. Within 2 days, he was transferred here to Loyola.
So in patients with severe inflammation of the surface of the eyes, we have been using some new surgical techniques to really prevent some of these scarring and blinding complications of Stevens-Johnson syndrome. And there's actually a tissue called amniotic membrane, which is harvested from around the human placenta.
We had two surgeries within the first few weeks for his eyes, where they did the amniotic graft.
So what's done with the surgery is the membrane comes as a very, very thin sheet. It's actually sutured or sewn just along the eyelash area, and then it's tucked underneath so it lines the inner lining of the eyelids. There's a lot of things in there that really tend to rejuvenate the cells. It promotes wound healing.
And Dr. Lynn and Dr. Bouchard both knew that the amniotic membrane graft was what he absolutely needed.
We just published a paper in the journal Cornea, which showed that patients who did not receive the amniotic membrane transplant surgery were about 8 times more likely to have poor outcomes than patients who did have the amniotic membrane transplant surgery.
We've been managing patients with this devastating disease for a long time, and they require a lot of support over time. When you talk to Ethan, you see what a zest for life he still has.
Ethan has come so far in the 3 years since his diagnosis. He has grown so much more than the average child.
We've saved his vision. He can play like a normal kid, and go to school like a normal kid. It's just so gratifying for me to be able to be a part of that, just as an eye doctor. To be able to save the vision of a small child is just, it's really heartwarming.
So we're going to continue. And now we have the treatment include withdrawal of all drugs, permanent monitoring of vital signs, hydration, parenteral and correction of electrolyte imbalance, bed lining and steroid control, temperature, oral mucosa with care solution bicarbonate and applications at MUC, Stanford rinse solution every 6 hours, care how thrombin drops, tears, artificial 2 drops, liquid and liquefied diet, antacids, and omeprazole. And now we have another video, so we're going to play.
SJS, or Stevens-Johnson syndrome, is a very rare but life-threatening condition, which is caused from a severe allergic reaction to certain medications. The allergic reaction normally begins with simple flu-like symptoms, followed by a painful red or purplish rash that spreads and causes blisters and skin lesions. Some patients who have severe SJS have to be treated at hospital burn units. If skin lesions become infected, or if the patient develops lesions in their lungs, death can occur in some instances. So this is a very serious illness. Patients diagnosed with SJS, or Stevens-Johnson syndrome, have reportedly taken over-the-counter drugs and prescription pain relief drugs and antibiotics. Some of these drugs include Motrin, Advil, or children's Motrin and Advil, Depakote, Dilantin, Levaquin, and Tegretol. Other symptoms from SJS can be blindness, lung damage, asthma, nail loss, scarring or severe burning of the esophagus, chronic fatigue syndrome, and arthritis, among others. The most serious form of SJS, or Stevens-Johnson syndrome, is a condition that is called TENS, or toxic epidermal necrosis. This is a very serious condition, where an increased percentage of the skin is affected, usually 30% or more. This condition can cause patients to be extremely vulnerable to infections, and this is the leading cause of death for those with TENS infections. We're presently looking at these cases. We're presently working with some of the leading pharmaceutical litigation firms in this country who are litigating these cases. These are serious cases. It doesn't cost any money to hire an attorney to represent you, as the attorney will get paid at the end of the case. They get a percentage of the recovery. And if there's no recovery, there's no fee. So feel free to contact us, either filling out an internet contact form or calling us at our toll-free number on our website. And we'd be happy to discuss the possibility of whether you think you or a loved one could have a claim from SJS or TENS. Thank you.
Well, we're going to continue, and now we have the final presentation. We finish. So everything was about syndrome of Stevens-Johnson, and of course the case that I present, the girl recupered her life. She fight without the syndrome of Stevens-Johnson, and nowadays she is okay, and she's without this syndrome. Thank you.